Buongiorno. I want to thank Christian Bellerin and the others at Circulo LGBTQ Maris for inviting me to address this gathering. I'm Dr. Ann Vitale. I'm a psychologist in private practice in the San Francisco Bay Area of California. I've been practicing and specializing in gender issues since 1978. I've been asked to answer 3 questions. Why is transsexuality considered a pathology? Are there other, less stigmatizing and perhaps more accurate words we can use to define the issue? And 3, how can the pathologization of gender issues change trans persons' lives? This is a very important and timely topic, and one can write a book on these 3 questions alone. But since I only have 10 minutes, I'll do the best I can. First of all, I need to clarify how I view the terms pathology and depathologization when used in the context of transsexualism. When it comes to transsexualism, nothing is ever black or white or conforms to any of the norms in the cisgendered world. Transsexuals live in a world where everything comes in shades of gray. Labeling transsexuality a pathology, especially as a mental disorder, is clearly an overstatement. On the other hand, calling it a pathology for people who are going to be needing medical care, I believe the term is appropriate. Please keep in mind that extreme gender variance is unlikely to ever be viewed as normal or freely accepted by parents, society, or even the trans persons themselves because it's outside normative, expected binary gender role presentation. It's also, especially when we factor in the unjustly related but ever-present psychosexual stigma. And there's the practical side. If people are going to be helped with medical procedures and medical interventions, and if professionals and insurance is to be involved, it will be in today's terms a pathology. Since there is no in-between or modified definition of pathology, our only recourse is to modify the wording of gender issues so that the stigmatization and emotional connotation is reduced to a more helpful terminology, while all the time being especially careful as to leave the individual open to access to medical care. Looking at question number 1, the reason transsexuality is considered pathology. This may sound like I'm being too obvious, but it's because gender issues are treated primarily by mental and medical health providers. To aid them in classifying their work, these providers have books and journals that contain lists and lists of ailments that they consider real and treatable. If the symptoms, in this case gender dysphoria, are in the book, it's considered a real disorder that deserves to be treated. For transsexuality, the book it is most commonly listed as the Diagnostic and Statistical Manual of Mental Disorders, or as it is more commonly known as the DSM. I believe all here would agree that transsexualism lies outside the norm of our binary sexing society. So when a group of psychiatrists describes a variation from the norm as a persistent sense of discomfort or inappropriateness about one's anatomic sex, and persistent wish to be the other sex, then decides to put the abnormality in the book of mental disorders, the connotation attached to the abnormality becomes a pathology in the minds of professionals, lay people, and even to some degree the transsexuals themselves. This brings us to question number 2. Are there other, less stigmatizing and perhaps more accurate words we can use to define the issues? My answer is yes. I've given this a lot of thought over the years, and it's pretty much started on my first reading of the DSM-4 back in 1994. I was immediately put off by seeing that transsexualism, as was described in the previous edition of the DSM, was now being replaced by gender identity disorder. I'd always thought of the term transsexual just described individuals who experience a variation on one's sense of being male or female. Nothing at all to do with identity. All of a sudden, what I've been dealing with over the last decade, as a psychotherapist was being considered a serious pathology that I and other psychotherapists were supposed to cure with talk therapy. A more problematical issue was that GID had been placed in the area of the DSM reserved for sexological disorders, right next to the paraphilias, such as pedophilia, exhibitionism, voyeurism, and a whole host of cross-dressing and sexual fetishes. First thought was, what were the authors thinking? Unless, of course, they thought that variations, the gender variation was some sort of perverse sexual problem. The term gender identity disorder so bothered me on first hearing that I had to give it a different name, even if it was my own use. It was not long before I simply started calling it Gender Expression Deprivation Anxiety Disorder, or GEDAD. I came up with the term because, quite frankly, that was what I was treating. Essentially, with this new terminology, I was hoping to move the issue from an identity disorder, a concept I did not believe in, to what it was that my gender issues clients were struggling with. For me, what I saw was anxiety, and I had a good idea what caused that anxiety and knew how to treat it. Back in 1994, when I first introduced the term gender expression deprivation into the scientific literature, I saw the anxieties being a combination of inadvertent physiological and sociological maladaptations. I believe the anxiety is caused first by certain individuals' inability to produce the cross-sex hormones their gender-variant brains need for psychological comfort. This is evident as when cross-sex hormones are introduced to gender dysphoric individuals, there's an almost immediate improvement in their sense of well-being. If, on the other hand, you give the same cross-sex hormones to a cisgendered individual, that individual experiences an increase in anxiety. That has become such a truism that the administration of cross-sex hormones, or anti-androgens in some case, is now the primary diagnostic tool used to determine how far the client should take any possible full or partial gender role transition. The second and equally important element involved in gender expression deprivation anxiety is the sociological aspect, or the granting of permission to express openly new gender role behaviors. This latter aspect is, of course, where the individual runs afoul of society. We are all painfully aware that family, friends, employers, religious institutions, and the legal system struggle mightily to maintain a binary ordering system of males and females. There are some, undoubtedly even some of you here, who would prefer to see all references to gender identity removed from the DSM. These well-meaning individuals usually evoke the history of homosexuality as having been has been removed from the DSM and never to be returned. However, I'm against that notion because, unlike homosexuality, many people with gender identity issues need access to medical care. For individuals who desire complete gender role transition, access to therapists, endocrinologists, and surgeons are the only way for them to get their needs met. But no diagnosis, national healthcare systems and insurance companies would not be required to cover even the smallest amount of the cost. In some countries, they pay for much of the necessary hormones and expensive surgical procedures. Regarding question number 3, how can the pathologization of gender issues change trans persons' lives? The first important way is psychological. There are socially acceptable pathologies and there are socially stigmatizing pathologies. Depression and anxiety, terrible and as problematic as they are common and socially acceptable, while anything that has to do with sexual behavior, gender identity, or gender expression are for a large part of society considered weird and perverted. As a consequence, too many of my clients come in to see me suffering from fear of discovery, difficulty functioning in their daily lives, with very damaged sense of self-esteem. This is usually caused by years of living in the shadows, racked with guilt and shame. Afraid or too ashamed to talk to anyone about their gender issues, far too many either go into denial about their situation or try to tough it out, often for decades. Who can blame them when they know that the mental health professionals that they may be seeking help may think that who they are seeking help from think they are suffering from psychosexual disorder? Another area of a trans person's life that can be aided by de-pathologization is in the public policy area. As long as government entities consider trans persons sick, let's face it, that's what pathology means to most people, there's going to be a natural hesitation towards accommodating us in areas of providing updated identity papers, access to medical care, laws that protect us from workplace discrimination, child custody rights, and even the ability to marry the person we love without bias. To sum this up, keep in mind that transsexuality is a phenomenon of its own, demanding further discussion as to how we replace the pathologizing, de-pathologizing questions. After almost 30 years of working with hundreds of trans persons going one way or the other, I've come to the conclusion that we should direct our attention from thinking in strictly male-female terms. We should instead, as professionals and lay people alike, simply consider an expression deprivation anxiety disorder, treatable by a combined physical and sociological adjustment, thereby bypassing entirely any social, psychosexual, or overly negative mental health pathology connotation. Thank you once again for giving me this opportunity to address this forum. Enjoy the rest of your program.